We are going in depth now. Sunday is World Alzheimer's Day, and joining me now is Dr. Stephen Salloway, the founding director of Butler Hospital's Memory and Aging Program. Doctor, thanks for being here.
Thank you for having me.
So you've really been on the forefront of Alzheimer's research. I know there's been a few developments over the summer. Talk me through what's happening in terms of developments in treating the disease.
Well, advances in Alzheimer's research is really transforming the way we view the disease. Previously, a lot of people thought, well, it's just part of aging. There's not much you can do about it. And increasingly, we're viewing Alzheimer's as a chronic neurologic disease that if we catch it early, hopefully we can learn how to manage it. And we have new blood tests now that can detect if someone is building up the plaques of Alzheimer's, so have early changes in the brain. And we have two new treatments approved by FDA that actually remove the plaques from the brain and help slow down the disease for people with early Alzheimer's.
That's fantastic. And can people get access to those treatments right now?
We're offering it over at Butler Hospital. There are other places in the area that are offering these treatments. And so they can ask to be referred if they're an appropriate candidate. So they have to have early Alzheimer's. So that means a mild stage, still functioning well. They have to not have any safety concerns that make them a poor candidate, and they have to also have evidence that they're building up plaques, either with a PET scan or a blood test or some other test.
You've been working in this field for more than 3 decades now. You've seen a lot evolve over the years. You were involved with the clinical trials for a drug called Aduhelm. A lot of excitement about it, but now the manufacturer is discontinuing it. Is that disappointing?
Well, Aduhelm opened the way because that was the first drug that showed that we could remove plaques from the brain and start to slow it down. Unfortunately, the way the study was conducted, it was controversial because one study was positive and the other study was not positive, and so made people uncertain, even though the FDA gave approval. But now with these 2 new drugs, they work in a similar way, but those studies were clearly positive, and the FDA gave full approval to both of those. So we're saying goodbye to Aduhelm, at least right now, for that form of it. But we have new treatments that work probably even a little better.
Still progress being made. For folks who are watching at home who want to protect their own memory and brain health, what can they do?
Eating well, a good Mediterranean balanced diet, exercising, being physically active, mentally active, and also making sure we keep control of high blood pressure, cholesterol, diabetes, smoking, things like that that put our heart at risk and our brain at risk too.
Absolutely. Dr. Stephen Salloway, thanks so much for being here.
Thank you so much. And please sign up for our prevention registry, which is, you can get the link online, and also take advantage of the walks that are coming up to end Alzheimer's this Sunday and next Sunday.
Absolutely. And if you'd like to learn more about Alzheimer's, please go to WPRI.com to watch our 12 on 12 digital original, The War on Alzheimer's. The battle continues.